Welcome to BraVRy. BraVRy presents an innovative solution aimed at revolutionizing the treatment of specific phobias and PTSD through the integration of cutting-edge VR technologies and comprehensive biotracking. Specific phobias afflict nearly 10% of Canadian adults, rivaling the prevalence of age-related hearing loss. In fact, the burden of anxiety disorders like phobias and PTSD collectively surpasses that of cancer. This highlights the pressing need for advancing interventions. Our framework, like all effective healthcare frameworks, puts the patient first. Utilizing customizable VR sims, BraVRy harmonizes an extensive spectrum of biotracking data, such as heart rate, blood pressure, breathing, brain activity, and body movement. This aggregated data, alongside a recording of each VR sim, is then uploaded to our website where an algorithm applies validated formulas to synthesize it and present it in an easily digestible review. From here, patients can review their own data and customize the VR environment how they see fit. Additionally, this data can be shared with doctors who themselves can support patients and their unique needs. The comprehensive array of validated parameters we provide offers a tangible understanding of anxiety levels, which fosters personalized treatment approaches. To end, I want to share a quote by Chris Milk, who says, "If you look at the medium of VR, we are broadcasting human senses to your consciousness. We are duplicating perception." Welcome to BraVRy, where science and technology converge to usher in a new era of precision medicine, transforming the treatment of anxiety disorders.
Hi, everyone. Today, we are going to be presenting a live demo of our project, BraVRy. We are going to first jump into the VR simulation. Welcome to our VR simulation. We start by spawning in the parking lot outside a doctor's office. For our demo, we've chosen to focus on treating iatrophobia, a fear of doctors and medical care. This fear can prevent timely access to healthcare and may lead to white coat syndrome, where being in a clinical setting raises blood pressure, potentially causing misdiagnosis. Now, let's walk into the waiting room. The system will record your current physiological measures, such as your heart rate, for analysis on our website dashboard. Feel free to interact with different objects in the room. We've designed a collision mechanic for a more immersive experience. We also decided to simulate a graded approach. We're exposing patients to a doctor's office. It's building furniture, devices, and environment without actual interaction with medical professionals or patients to help ease them into the therapy. Now, as we approach the doctor's office itself, we'd expect a patient with iatrophobia to experience an increase in heart rate. Here we are, entering the doctor's office. The patient's heart rate would likely be elevated at this point. You can interact with objects in the office, like the patient chair and bed, to increase familiarity with the medical setting. Throughout, we're monitoring your heart rate. Thank you for joining us in this VR simulation. Our approach aims to make exposure therapy more accessible and effective. Now, let's head into our website dashboard to see the data and progress.
Welcome to the BraVRy website. We custom built this site to directly integrate with our VR experience in real time. Let's check out the dashboard to see more. The dashboard is where the unique patient data lives. Patients and doctors have ready access to this portion of the website to guide care. On the sidebar, we can see a Sessions tab where data and recordings from previous VR experiences exist. Also on this side tab, we have a health tracker summarizing long-term data trends and a calendar where doctors and patients can schedule their next VR session. Below our patient identifiers, we have an easily digestible collection of physiological measures associated with anxiety for patients or clinicians to browse. As we scroll down, we can see an example of a chart that our website created from the real-time VR demonstration that we just saw. Charts like this, along with further data analysis for each physiological parameter, will be available for patients to review after each session. At the very bottom, we collect timestamps of each unique event that occurred during the sim. This is helpful to guide patients in their understanding of which specific aspects of the sim cause the greatest levels of anxiety. Lastly, we wanted to circle back and discuss the impact and commercial viability of BraVRy. As mentioned earlier, the disease burden of anxiety is enormous. In fact, it's greater than that of cancer. To illustrate this, anxiety disorders cost the Canadian healthcare system over $6.8 billion in 2022. When considering the enormity of a problem anxiety disorders such as phobias and PTSD present, the impact that BraVRy is poised to make is profound, ushering in a new era of precision medicine for anxiety disorders. Thank you so much, and we would love to hear your questions.
Thank you for presentation. Just wanted to, if you could clarify how you're measuring heart rate, blood pressure, and a few of the other
I can
parameters.
actually speak on that.
Thanks.
Right. So we actually measure heart rate using the Muse, which collects PPG data. And that actually is an LED that responds to changes in blood flow during the systole and the diastole. So essentially what happens is during the systole, when your heart is contracting, blood is being pushed out of your arteries, and essentially you get increased amounts of blood flow. And that's actually detected by the LED. And this will actually be detected as peaks. So within the actual graph that you get in the PPG, you can look at the different peaks and you can find the frequency of the peaks. And through that, you can calculate the heart rate.
So I was noticing in your dashboard that there was a calendar function so that the user would navigate the scenario with the clinician. Is that correct? It wouldn't be like a self-navigation?
Thank you for that question. The calendar function would allow both clinicians and patients to schedule in their own appointments. So yes, there's an avenue in which patients could totally self-schedule, and there's also an avenue in which patients could work with their doctors to schedule regular VR sessions. So both, really.
Thank you.
Thank you. My quick question, you mentioned about the costs for disorders, particularly with phobias, some $1 billion. And then your last slide, the impact slide, talked about how there's an impact of, and BraVRy could be an answer. My question is, have you done any calculations, any projections on how BraVRy can be saving the system and how much can BraVRy be saving the system? Thank you.
Yeah, another fantastic question. Although we didn't do any economical analysis about how much we feel this project can save us, or BraVRy could save, what I can say anecdotally, as a medical student who's been in a lot of doctors' offices, who's been with a lot of family doctors and psychiatrists, anecdotally, there is such a need for us to address anxiety in ways that don't involve direct pharmaceutical intervention. And I think BraVRy is poised to, or is at that perfect intersection of personalized medicine and treatment progression, where it can make such a big difference.
Thank you. Thank you.
Thank you all so much.